Antidiabetic drugs. Overview and key classes. Antidiabetic medications manage hyperglycemia in diabetes mellitus by targeting insulin secretion, sensitivity, or glucose metabolism. Below is an organized summary of major classes, mechanisms, examples, and clinical considerations. 1. Insulin mechanism. Replaces endogenous insulin deficiency, type 1 German mark, or supplements insulin, type 2 German marks. Types: rapid-acting, Lispro, Aspart, Glulicine, onset, 10 to 15 minutes. Short-acting, regular insulin, onset, 30 to 60 minutes. Intermediate-acting, NPH, peak, 4 to 8 hours. Long-acting, Glargine, Detamir, Degludec, duration, 18 to 24 plus hours. Indications: type 1 German mark, advanced type 2 German marks, gestational diabetes. Side effects: hypoglycemia, weight gain, injection site reactions. 2. Biguanides mechanism. Reduce hepatic gluconeogenesis, enhance peripheral insulin sensitivity. Example: metformin, first line for type 2 German marks. Indications: type 2 German marks, prediabetes, PCOS. Side effects: GI upset, diarrhea, nausea, lactic acidosis, rare, contraindicated in renal impairment. 3. Sulfonylureas mechanism. Stimulate insulin secretion from pancreatic beta cells. Examples: glimepiride, gliburide, glipizide. Indications: type 2 German marks, second line after metformin. Side effects: hypoglycemia, weight gain. 4. Meglitinides, glinides, mechanism. Short-acting insulin secretagogues, target postprandial glucose. Examples: repaglinide, nataglinide. Indications: type 2 German marks with irregular meal schedules. Side effects: hypoglycemia, less than sulfonylureas. 5. Thiazolidinediones, TZDs, mechanism. Activate PPAR gamma receptors to improve insulin sensitivity. Examples: pioglitazone, rosiglitazone. Indications: type 2 German marks, insulin resistance. Side effects: fluid retention, weight gain, fractures, bladder cancer, pioglitazone. 6. DPP-4 inhibitors mechanism. Inhibit dipeptide L-peptidase 4, prolonging incretin, GLP-1, GIP, action. Examples: sitagliptin, saxagliptin, linagliptin. Indications: type 2 German marks, add-on therapy. Side effects: nasopharyngitis, pancreatitis, rare, joint pain. 7. GLP-1 receptor agonists mechanism. Mimic GLP-1 to stimulate insulin, suppress glucagon, slow gastric emptying. Examples: liraglutide, semaglutide, dulaglutide, exenatide. Indications: type 2 German marks with obesity, CVD, some approved for weight loss. Side effects: nausea, pancreatitis, thyroid C-cell tumors, contraindicated in men too. Benefits: cardiovascular and renal protection, e.g., semaglutide. 8. SGLT2 inhibitors mechanism. Block renal glucose reabsorption via SGLT2 transporters. Examples: empagliflozin, canagliflozin, dapagliflozin. Indications: type 2 German marks with heart failure, CKD, or atherosclerosis. Side effects: genital mycotic infections, UTIs, euglycemic DKA, volume depletion. Benefits: reduce heart failure hospitalizations and CKD progression. 9. Amylin analog mechanism. Mimics amylin to slow gastric emptying, suppress glucagon. Example: pramlintide, adjunct to insulin in type 1/2 DM. Side effects: hypoglycemia, nausea. 10. Alpha-glucosidase inhibitors mechanism. Delay carbohydrate absorption in the gut. Examples: acarbose, miglitol. Indications: postprandial hyperglycemia, type 2 German marks. Side effects: flatulence, diarrhea. Combination therapies. Examples: metformin plus SGLT2 inhibitor, e.g., empagliflozin. Metformin plus DPP4 inhibitor, e.g., sitagliptin. Fixed dose combinations, e.g., insulin degludec, liraglutide. Special considerations. 1. Comorbidities. CVD, heart failure. Prioritize SGLT2 inhibitors or GLP-1 agonists. CKD. SGLT2 inhibitors, EGFR permitting, or GLP-1 agonists. Obesity. GLP-1 agonists, SGLT2 inhibitors, or metformin. 2. Safety. Avoid metformin in severe renal impairment. Avoid TZDs in heart failure. Monitor for hypoglycemia with sulfonylureas, insulin. 3. Cost, adherence. Consider patient access, dosing frequency, e.g., weekly GLP-1 agonists. Emerging agents. Tirzepatide, dual GIP, GLP-1 agonist with superior HbA1c reduction and weight loss. Oral GLP-1 agonists, semaglutide, Rybelsus. Lifestyle modifications. Key adjunct: diet, exercise, weight management, and glucose monitoring. This structured approach tailors therapy to individual needs, optimizing glycemic control while minimizing risks. Always consider patient-specific factors, e.g., comorbidities, cost, adherence.